Today is February 25th. It is Wear Pink Day. I'm doing my part, and as many across the station here at Rogers TV are as well. But why are we doing that? We bring in Marvin Shank, who is a spiritual care practitioner and member for the of the Ontario Alliance of Mental Health Practitioners. Marvin, thank you so much for being here.
Good to be here with you on this day.
Why is today such an important day? First of all, what is the significance of us wearing pink?
Well, the National Pink Shirt Day highlights for us some of the tragedy of bullying, as well as highlights for us in an inspiring way that we be involved in engaging in supportive ways with people who really are suffering from having been bullied.
I think one of the keys for the pink shirt is really just starting a conversation. What would we like that what kind of form would we like that conversation to have?
Oh my, it's to bring people out of the shadows of their pain, their isolation, and some of the various very detrimental experiences like depression, and of course ultimately people even get suicidal ideations, like they're not even wanting to live. Their self-esteem is eroded, and self-worth. It seems to me that not only is the humanity of the victim eroded, but even the person that is perpetrating this kind of stuff is dehumanizing themselves in a way that's really very unfortunate.
Are we going in the right direction? Are we doing enough to solve this problem?
Well, certainly building awareness is central. And as you build awareness, then people who are afraid, ashamed of themselves, in the shadows of their experience, can come forward and do something different. And that's what we really want.
You know, one of the things that we constantly hear is that we have a lot of programs, and many of them are covered or represented by the Ontario Alliance of Mental Health Practitioners, but it's the accessing, taking that first step and getting the help and accessing those services. Is that where the gap exists, just reaching out and making contact?
I think very much that's an important feature. And how do we do that? I mean, one way of doing that is to go searching on the web pages for resources, but there's also local agencies that are very much involved. That I'd like to highlight both of those features.
Well, then let's talk about the Ontario Alliance of Mental Health Practitioners. Who is represented within that alliance?
Well, certainly the association I've been a part of for years is the Canadian Association for Spiritual Care. But in addition to that, there's art therapy and there's music therapy, various modalities. I'm humbled by the variety and the availability of different kinds of services. So one can go on the web page of the association, just give that to you, OntarioMentalHealthAlliance.ca, and find possibilities of service. That represents professional associations across the province. But in addition to that, I think it's important to think about London agencies that can be accessed.
All right, help us out then. If maybe that's something we're not terribly familiar with and we haven't done a whole lot of research, how many agencies, what's the breadth of agencies across London?
I'm not sure I can tell you how many agencies, but certainly the problem of bullying affects people of all ages. So if it's women, there's the Women's Community House, but I think of Dea Counseling Center, I think of the Family Services Thames Valley. As other agencies, and both of those two, Dea Counseling and Family Services Thames Valley, are agencies that are funded by various sources, making it possible to reduce the barrier of access around fee-for-service.
So are we doing better than getting rid of those barriers to access, and are things getting better?
I would hope so. That is how to document that we are improving. I think we can document that in terms of the numbers of people that come. For example, at Dea Counseling Center, almost a third of the people that are served there during the past year were people that were suffering from some form of abuse, which suggests that we are succeeding.
Let's talk about you and spirit. What form does spiritual care as a spiritual care practitioner? What does it take? Well,
spiritual care is a profession that's been developing over the last 50 years. This year we mark the 50th anniversary of our association. My work and many of others of my colleagues has been in hospital settings as hospital chaplains, where we've been trained, clinically trained to provide spiritually integrated psychotherapy for people from all kinds of backgrounds, whether they're religious or non-religious or atheists. We're engaging their human capacity, spiritedness, for resilience and well-being. So I've been doing that for many, many years in a psychiatric hospital here in London.
And you know, you mentioned an interesting aspect as well, that it is the victims of bullying who you know, lose their humanity, as you said. But do you also find that the people who are perpetrating these acts also need that care? And
They certainly do. They've lost their way as well, and often bullying is an expression of their own diminished humanity that has, for some reason, happened that way, and they're acting out in some crazy ways. I say crazy, meaning that it's very destructive.
Absolutely. What would you hope comes out of Wear Pink Day?
My passion for it would be that people who feel abused come out of the shadows of fear, out of the shadows of their own kind of loneliness and withdrawal, so that they can actually say, I'm not alone. There are a lot of other people that have been hurt, and I too can find some help somewhere. There is help available. People need to know that and trust that and pursue that.
Well, Marvin, thank you so much for being here. I really appreciate you coming on and talking about this.
Well, thank you so much for having me here. I hope that many people access services.
Well, it's easy to do. OntarioMentalHealthAlliance.ca is the website. Hit that website. We'll be back with more right after this.